And then lastly, as I mentioned, the whole process is designed to return the fluid back to the heart to keep blood volume and to maintain the circulation throughout the body. I will say lastly that with I cite the guys out there. We can see where all the lymph nodes are. When we're using the fan to promote fluid transfer, we're really going to we're going to try to end the fan up where the lymph nodes are. So we're going to take it towards the medial knee. We're going to take it up towards the thigh and through the groin when we're working with lower limb, and when we're working with the arm and the upper limb, we're going to take it towards the armpit where most of the lymph nodes are situated. As well as one thing that we've been very successful with a lot of our teaching is using it through the neck and using the small fan in that area. We've had some great results. People saying they feel lighter, less congested instantly, and we can understand why, being with how many lymph vessels there are like through the neck. Okay, so as we jump into our first of two studies that we're going to look at, this study, very interesting. We looked at the effect of kinesiology tape, and they actually did use a fan in this instance. The fan ProCut versus manual lymphatic drainage, and the control in this group was exercise, and the reason being is because they used a total knee replacement as the mechanism to create the increased fluid in the area, the swelling, the inflammation. And so they measured everything right after the total knee replacement. You would expect there to be a bunch of fluid in the area. And so that was the kind of how they anticipated the fluid to be in the area. And so with all of these groups, they did use exercise. So it was the kinesiology tape with exercise, the lymphatic drainage manual technique with exercise, and then exercise was the control. And the reason being that, well, they just did a total knee replacement, and they wanted to make sure that we didn't lose any time with getting the knee moving again and making sure we restored the range of motion in the knee. With our chart here, so we looked at initially, there's a couple of outcome measures. The first one is looking at getting rid of the swelling. And so they did limb circumference measurements. And so in this situation, we looked at the 4 different areas of the body. And then we looked at what the tape, the manual technique did, and then also the exercise. And what you'll find is that, and these are all comparative to the pre-op. So this is comparative to where the measurements were before they did the surgery. So consistent throughout, we'll see the kinesiology tape and the lymphatic drainage technique are pretty much even. They will get kind of similar results throughout. And then the exercise group, which was just exercise alone, will always be a little bit worse. So in this case, we saw a increase would be an increase in the diameter, but they just had the surgery, so we want kind of a lower number there. So we have 35% for both, and then the 46, which means the knee was bigger after 4 days of use. Throughout the thigh, we see the kinesiology tape group after 4 days it returned to the pre-op size. So we got essentially back to square after the surgery. And then the manual lymphatic drainage and then also the exercise group still was a little bit puffier, still a little bit bigger. The calf, similar thing. We start to get kind of similar results throughout, except with the kinesiology tape group, it was on day 3, but the second day of kinesiology tape use that we flipped it. So with the kinesiology tape group, we actually saw the calf was smaller than it was pre-op. So this is where we see that we actually start to see improvement, which is after 2 days of kinesiology tape use. And then after the 4 days, which was the extent of the study, we see that the kinesiology tape group had a 7% decrease in the size of the ankle. So we start to see some pretty impressive results. The second outcome measurement that we looked at was pain. And we see that our best pain measurement here was with the manual lymphatic drainage technique, followed by kinesiology tape. And then I guess you would expect to see the exercise group alone. It was they maintained a higher level of pain. And so both in the kinesiology tape and the manual technique, we're seeing big changes in the VAS score. So we're going from like 6 to a 2, which is a pretty significant decrease in the amount of pain that people are reporting. And then our last outcome measurement was the restoring range of motion, inflection, and extension through the knee. And then we see here that, again, our manual technique, our kinesiology tape maintain a similar outcome, and the exercise kind of falls a little bit further behind. And so the conclusion here was both the manual and the kinesiology tape groups, they both had a significant improvement throughout the study, and they would be recommended, which I think is a pretty significant thing to understand from a kinesiology tape standpoint, because we all know the benefits we've seen from the manual technique. And if we take that and we expect the kinesiology tape to have the same level of benefits, then I mean, I think that's pretty impressive result for tape. I also think that in clinic, you're never going to do one or the other. We're going to do both. So you're going to do your manual technique, and then when you finish, you're going to put the tape, you're going to put the Pro Cut on. And so we're not making a decision, well, we're doing one or the other. We're making a decision to do it all. And then even further than that, I think that having the tape on between manual techniques will keep the lymphatic vessels open. So then when you go back in to do your next technique, where in this case it was the next day, then the fluid's going to flow even more effectively. So I think if you did another study where you took this exact same study and then you made a fourth group and you did manual technique and kinesiology tape, I think you would see big improvements even over the two on their own, the tape and the manual. So I think a pretty interesting piece from that standpoint, and something to kind of certainly consider as using tape through right after your manual technique. If anyone's interested, I will say the technique they used was a half an hour manual technique where they started with the hip and they flushed out that area, moved down towards the knee, down towards the ankle, and then made their way back up towards the hip and up towards toward the knee and then the hip. So they moved down, kind of opening up the vessels down to the ankle, and then move their way back up towards the hip, which I think would be pretty standard manual lymphatic drainage technique. I mentioned before that the mechanism that the tape is successful, and really with the manual technique as well, because you're displacing the skin. So this would be similar throughout. But the key being here is that the tape goes on the skin, the elasticity in the tape retracts back on itself, it lifts up the skin, and we have a pull upwards while the tape is on there the entire time. And if you look at kind of the image here with the lymphatic vessel, the skin is what's above it, and so if we're pulling that skin up, we're elevating that skin. You can understand why those anchoring filaments become so important, that they keep that vessel open. Even if we have a swelling coming from below, the pull from above is enough to kind of keep that vessel open, prevent pooling, and preventing the swelling from staying in the area, which has massive benefits. I mean, just in terms of the body not sensitizing the area, the immune system not breaking down the tissue, so we maintain collagen fibers and so on. So a hugely important result from really a simple mechanism. Our second study is designed to go a little bit more superficial. We're not going to dive into the comparing the two. Really, all I want to do here is prove the technique, prove what we're saying is reproducible. And so what they did in this study was they looked at someone who is healthy, which also is important to keep in mind. So these people are healthy. They applied tape to half the group, kinesiology tape to half the group. They applied white medical tape to the other half, and they looked at what happens in the space just below the skin, in that interstitial space, and what they what they found was essentially that the kinesiology tape, because it retracts back, as I said, it lifts the skin. All of a sudden, we get an increase in that interstitial space comparatively to the white medical tape, which kind of restricts range of motion, keeps things pinned down. And what we saw was right away, as soon as we apply the tape, we saw an 11% increase in that interstitial space. And that interstitial space is also where the lymphatic vessels hang out. And so it's where they allow the flow. And so that becomes a pretty important area. And then after 24 hours of using kinesiology tape, we saw a 16% increase in the distance of that space. So the space where the lymphatic vessels are increased by 16%. Also, I mentioned this was with healthy people. There's many other studies that will look at what happens when you are injured. And so the fact that this is a healthy person, I think it limits the results because with the after an injury, again, you would see the swelling move up from the tissue up into the interstitial space, pushing up against the skin. And so the tape becomes even more significant when you're dealing with someone who is injured and there's swelling, there's tension, and there's pooling happening in the area. And for a visual, we see that, moving on to that next slide, we see that the tape going on the skin, it pulls up, and then that yanking up on the skin affects the lumina again through the anchoring filaments. So we're going to wrap up this kind of the science, how it works. But I will say that the kinesiology tape, the ProCut, works in a couple of different ways. We mentioned how it kind of goes on the skin, it lifts up. The second way that it works, and you'll see our fan spider here. This is our small fan. We have two different sizes. With the fan, we want to apply it so we get a distance between the strips that go down. So we end up with a kind of a pressure gradient difference because under the tape, where it pulls up, we decrease the pressure. Where there's no tape, the pressure maintains high because there's swelling. And then that alternates tape, no tape, tape, no tape. So we get a pressure gradient, high and low. And so that gradient will promote the fluid in the area to move towards the area of low pressure, which again, and then once we find the area of low pressure, it will flow up and easily move up towards the heart, which we mentioned before. And so the tape works the two mechanisms to get kind of the maximum results, being that the lift up is one mechanism, and then the fact that we have the alternating tape, no tape is the other as well. When we apply it, which we're going to see in a moment when we look at the video, we want to stretch the area that we're putting the tape on. So if we're using the arm, we're going to stretch the arm. If we're using the calf, we're going to stretch the calf. And then you're going to apply the tape with the same tension that is on the backing paper, which is about 10%. So the tape is stretched on the backing paper, so it maintains its shape within the packaging. And so it's that 10% stretch when we put it on will maximize the lift up, and then we don't have to worry about the extra stretch having negative impact with restricting range of motion. Mostly because when people are puffy, swollen, they're not going to go through their full range of motion in an aggressive, significant way. So we can apply with a little bit of stretch, and we're not going to fear any kind of shear through the skin or reaching full range of motion. And then if we look onto the next thing, the next slide, which is going to be our application. We'll play through a video and I'll talk my way through it here. So this is our application video. It's on our website and it's there for everyone to see. So you can always kind of go back and see again how to apply our fan. The important thing to start with is, again, we're going to stretch the area we're putting on. So in this case, I'm going to stretch the calf. And so you'll see as I kind of get in here after we get rolling. Yeah, so I'm going to stretch the calf, and I'm going to do that in a way that I'm going to use my thigh, use my hip to kind of keep the ankle on a dorsiflexion. I'm going to try to keep the area straight, the knee straight, and then I'm going to break all the perforations to begin with. And this becomes really important because with the small, thin strips of the fan, we have to make sure that we do not touch the tape. The tape is a little more delicate than the other bigger, broader pieces meant for other parts of the body. So with our fan, we cannot touch the back of the tape. Otherwise, it will not stay as effectively. So you see what I did there was I placed the base on and I just kind of used the backing paper to roll onto the skin. Really important there that, again, we're not grabbing the tape. I'm not going to get any of the adhesive stuck to my finger, and it's getting on the area as effectively as possible. So as I move down here with the 4 different strips, I'm going to start with the middle 2 strips, and that's only because I want to make sure I'm over top of the middle of the area where we have the swelling, the puffiness, the soreness, the area we want to have the maximum benefit. And so then I'll start with the 2 middle ones and move my way out. As I mentioned before, we want to keep a centimeter between each one of the strips. So the strips are a centimeter. We want to keep a centimeter between the 2 of them. So we keep that pressure gradient so we can get that fluid moving out of the body as effectively as possible. And then as we go from the middle 2, we can then move out to the outer strips. And then apply. The whole time we are maintaining the stretch in through the calf to make sure that we get that on the skin, and then when we release it, the skin can retract back as much as possible, so we get that lift, that pull up, and we can get that maximum pull through the area that it's being placed on. Excellent. Okay. And then the last thing that I will say about the application is that you can see in this picture, we have the basket weaving effect where we have 2 different strips that are placed together, and we have that crisscross basket weaving look to it. This is something that I think can be very effective. The pros and cons are that the area that the tape goes over top of other tape, we have retraction over top of retraction. So we're going to get a bigger lift in through the skin just because we have twice as much lift up over top of the skin in that area from the 2 pieces of tape. So the results potentially can be better. If you want the maximal results as quickly as possible, I would then go with 2 different pieces and kind of go crisscross in this basket weaving look. The only downside is that the tape doesn't adhere to other tape, the cotton, as well as it does to skin. So there's potential for the application maybe not to last quite as long because the area where we have tape over top of tape becomes a little bit of a weak point. So maybe we don't get the 4, 5, 6 days out of the application. Maybe we lose a day. But the results could be more effective. So something to think about when you're deciding whether we just go 1 pro cut or 2 pro cuts in that basket weaving look. And that's going to wrap things up. We're going to review our goals again. We went over how we can use the fan pro cut to enhance our lymphatic drainage technique. We looked at why that works and how it works. And then we also looked at the application process, giving you an idea of how to physically apply it to your patient, and where to go to see that again and kind of get some more information about application itself, which is the Spidertech website. At Spidertech, we're always, as we kind of go back to our mission, we're trying to simplify. We're trying to give everyone the best experience using kinesiology tape. We have tape for every client. This happens to be for our clients who have lymphatic drainage issues, who are swollen, puffy, they're bruised, there's inflammation, there's experiencing some delayed onset muscle soreness, there's creatine kinase because of muscle breakdown, there's lactic acid. This is all the swelling piece. But we also have the getting rid of pain, muscle tension, improving posture, and improving our proprioception, which if you go back to other webinars, you would find all about. And then the last thing that I will say and probably one of the important things is that we're the treatment between treatments. And so to go back to our first study we looked at, we had the manual technique. We would put the tape on, and then you would go back and do your technique again. And I think that's how you're going to see your best results. I think when you combine everything you have at your fingertips, that's when you're going to get the best results for your patients and your clients. And then simply because our tape is it is high quality, it is effective, it looks really cool. People are going to talk about it because they're going to see it on your clients and your patients, and they're going to ask questions, and they're going to say that it feels amazing, and you should go see whoever you're working with to kind of get the same results. So that's why it ends up being a bit of a business card for you when you send your clients out into the world feeling better than when they came in to see you. That wraps up the webinar. We're going to move on to our Q&A portion. I hope this stimulated some thoughts, and if you have any questions about this or your experience using Spidertech in general, let's chat.
Yeah, if you open up the chat, you might see you got one question already.
All right. Yeah, so the first question is, and thank you, Kaylee, again, do you have longer strips that can be used on the arms and the legs or the torso, so we don't have to just kind of go multiple smaller strips throughout? And the answer is yes. We have a small and a medium size of this, and so the small and the large. So the large is big enough. It was the one that was in the video. It'll go from the knee all the way down to the ankle, the hip all the way hip all the way down to the knee or down the lower limb for your bigger clients. The picture that we had of kind of over the bicep, that was the one where we had our small fan. And so the two of them you would choose, but the two common places we would use a small fan would be kind of bicep or the neck, and then the large would be kind of on the upper and lower limb. And then if you want to do the basket weaving, you would just use the two of the same size that you decided on to crisscross.
They can put in questions in the chat.
Yeah, so I think there's two ways we can do this, guys. We can put questions in the chat. I also think we can do voice questions as well. So if you want to just unmute yourself and ask the question, we can kind of have a dialogue that way as well. As well as you can type them if that's easier.
So there's a follow-up question in the chat.
Yeah, great question. With all of our Pro Cuts, we make them as easy to use, as simple as possible. So there'll always be a numbering system, kind of guiding you on the way along the way. So on the back of each one of the Pro Cuts, you'll see that the base goes on first. You apply that, and then each one of the strips goes down. Each one of the strips is listed as kind of the same in like the same order, so you get to choose which ones you use. I mentioned in the presentation that I like to do the middle two first, so I kind of stay centered on the area I'm trying to have the effect. But certainly you can use as you wish. And then I'll also say that if it has a numbering system, but then you can also each one of the pro cuts comes with written instructions that you can read with pictures, and then you can also visit the website to see the video version. And then there's a QR code in each one of the packaging, so you can kind of click a cell phone and it pulls up the video. So we've made this as easy as possible for you to get your hands on the content to apply properly. You say that. Yeah, so Kirsty, so yeah, so that was kind of me, I think, kind of extrapolating. So in the study, they use either the manual lymphatic drainage or the kinesiology tape. My thought is if you did both of them, so you would do the manual technique, you would apply the tape, and then you would when they came back for the next session, you would remove the tape, you would do the manual technique again, and then you apply tape again, and so on. That's how I think you would get the best results. That's how I've gotten my best results with my patients. But in the study, they separated them, and for whatever reason, their what they anticipating happening was that the manual technique would be better than the tape, but they both would be better than the control group, which was the exercise. And what they found was, yes, they both were better than the exercise, but that the manual technique as well as the kinesiology tape were equal in their effectiveness. Yeah, so with our old uh, roles, they did have more elasticity in our in the roles themselves. So it did have more of a stretch. So the question was that they've seen they've used ProCut, they've used the roles. I think they're talking about. I think that is what Gene is talking about, and that the role had more stretch, and that is the case. The roles did come with more stretch. We've changed that. We've gone down to a stretchiness that consistency that we think is the most effective. And so now everything should be more uniform with the same level of stretch. But I think when we're applying the ProCut, as long as we're stretching the area we're putting it on, we're putting it on with that 10% stretch, and then it's retracting back up. We get a significant lift, and it's because of that it'll also stay on for the maximum amount of time it can for the thinness of the strips. And we will, guys, we will make this recording available for future for future viewing, but also the studies we talked about, they'll be listed as well, and so you can go in and read them yourself and kind of dive deep into a little deeper than we've gone. But yeah, pretty interesting stuff. I suggest that whether you start if you haven't used the ProCut on your clients and patients like this before, give it a try on yourself, kind of see how it feels. I think the area that people seem to kind of feel the most lift is initially is through the neck, and so you kind of place it on You want to kind of go down through the neck this way. You don't want to wrap it around because it's going to lift up. And then we get kind of like a constriction feeling. You want to kind of move down like so. I think you kind of instantly feel that lift, and if there's any congestion in there, you'll feel it yourself. And then, as I said, this is kind of my secret weapon. This is anytime someone comes into the clinic and they've tweaked something, they've injured something, something feels puffy, something is swollen, I'm getting tape on there as the last thing I do in my treatment every time, because I know that they're going to come back and they're going to be in a better position than when they came in. So give it a try with your clients and patients, because I think you'll see some pretty cool results right away. We'll go one last call for any more questions, guys, before we wrap up. But another great webinar. Thank you for being here today. As I said, the numbers are sky high comparatively to where we've been in the past. We have our great setup here. We're going to keep working to bring you better content and more content and do it in the most effective ways. So keep tuning in. We're going monthly, and we're picking titles and topics that I think are really going to help you in your practice. And I'm looking forward to more webinars as well. So I think we'll wrap that up. Thank you, everyone. Have a great rest of the day, and we'll see you in a month.